Most times I receive messages from clients saying, I need something for my face. And the first question I ask them is, what is your skin type? Because before any beautician or any product seller or vendor can recommend a product for you that would be effective and will have less allergic reactions, they have to actually find out your skin type, so and ensure that you're also using the right product for your skin type and not the wrong product for that particular skin type. So most times when I ask my viewers and even my clients, all they say is, I'm fair in complexion, I'm dark in complexion, I'm chocolate in complexion. That's your complexion, that's not your skin type. So in this video I'll be doing justice to the different types of skin type. So please, fair, dark, chocolate, caramel, that is your complexion and that is not your skin type. So I'll say that genetics plays a very principal role. Hormonal changes also play a role in your skin type. For instance, when I'm pregnant, I always have oily face. My facial skin is always very oily, my body is always oily, and then after I give birth I have dry skin. So hormones play a role in your skin type. So in this video I'll be telling you the different types of skin and the products that would work best for you. I'll also be giving you a test, more like a mini patch test, so that you can decipher what product best works for you. So basically, we have normal skin, we have dry skin, we have oily skin, and then we have a combination skin, which can be a combination of either oily and normal or dry and normal. We also have sensitive skin. This is not a major skin type because your skin can also be normal and sensitive, dry and sensitive, oily and sensitive. So the main skin types are normal, dry, oily and combination. But you can just tag sensitive along with it, and you can also tag acne prone skin along with it. Those are more like skin conditions and not necessarily the skin types, but most people also categorize them as skin types. So I will tell you the different types of skin. We have the normal, oily, dry, sensitive and combination, like I said. So for normal skin, it's neither dry nor oily, few discolorations, blemish free and appears smooth. Oily skin has a shiny appearance, enlarged pores and is prone to acne and blackheads. Dry skin is flaky, dry, tight appearances. It looks dull and lines easily develop. Then we have sensitive skin, which sometimes appears red, broken capillaries appear and may feel itchy. And then we also have the combination skin, which is a combination of oily areas, some dry areas or some normal areas, which is usually characterized by large pores, and these people are also prone to acne. So it's best you know actually where your skin, for the category of skin falls under. So for oily skin, looking at it, you can see visibly enlarged pores. You can see that most times the skin looks shiny or sometimes a little bit greasy. They are prone or susceptible to frequent acne breakouts like pimple, blackheads and all of those. Then we also have the dry skin. It looks flaky, dry, dull and stretched. The pores are not visible and is prone to age lines and sensitivity. Next up is the combination skin. This is usually a combination of two or one or more of the above skin conditions. Most times it's sensitive, and sometimes they also have blackheads around the nose. Then we have the normal skin. This is a smooth, clear skin, no blemishes, no excess oils, no enlarged pores. Everything appears normal. And then we have sensitive skin, which is sensitive to allergies, irritation and rash. So I would say, to know if your skin is normal, when you apply your tissue paper, the tissue will show no trace of oil. Your skin is There will actually be no trace of oil on the tissue paper by midday. And then um normal skin is the least problematic of all skin. It's the regular standard skin type. So for oily skin, when you clean with the tissue by midday, you will have spots on the tissue, you will have grease, a little bit of grease and oil on the tissue. And dry skin, it normally feels dry and tight, and most times it's susceptible to aging, premature aging, wrinkles, and fine lines. So for sensitive skin, it's easily irritated, may have bumpy texture, dry patches, and it reddens easily. For sensitive skin, we advise that you use products that are not fragrance. Use fragrance free products, cruelty free products, products that have mild ingredients. And you should also do your patch test regularly to know how your skin is faring. So sensitive skin always has symptoms like itchiness, red bumps, and all of that. Sensitive skin, you will have to watch what you use, particularly your soaps. You must use non-comedogenic soaps, and also stay away from harsh products that contain fragrance, that contains things that may likely irritate your skin. You are supposed to stay away from lightening products that may use of hydroquinone and other sensitive products as well. So for dry skin, it has nothing to do with lack of moisture, but most times it's characterized by tight pores. They always have rough and dull complexion, visible lines, red patchiness, and it's best treated by using a cleansing milk, using regular SPF, avoiding the sun so that it can delay signs of premature aging. And for those who have dry skin, I would say please avoid using hot water. Always ensure you use warm water or regular tap water, because hot water actually dries the skin. I even noticed I have normal skin. I have combination on my face, which is a combination of normal and oily. But on my body, I have normal skin. There was a time I was using hot water regularly, and I noticed that I began to develop very, very dry skin. So for oily skin, it's a shiny skin, and most times it gets worsened by hormonal changes or eating high alcoholic, using high alcoholic contents products. Most times we are susceptible to blackheads, spots, and enlarged zones, particularly around the T zone. I have oily skin, and most times when I eat fatty foods or greasy foods, I tend to break out very, very easily. So most times, don't dry your skin out. Do not overwash, and always use a gentle cleanser, because most times when you overwash, you tend to dry it out, and then the skin will begin to overwork itself, thereby producing more oil from the sebaceous glands to keep the face moisturized. So I would recommend that oily skin, do not overwash, do not also over cleanse, do not use products that will dry the skin out. Next is the combination skin. Combination skin can be tricky to identify because it features more than one. So most times people with combination skin, they always get confused. Because it's tricky. You have more than one skin, and then it's most times a combination of oily and normal. Sometimes it's normal, sometimes it's oily, sometimes it's normal, sometimes it's dry. And then you treat it by treating the different areas separately, or particularly using lightweight gels and oil absorbing products to tame or control the T zone, and then you use a nourishing cream for the dry part. So combination products also work for combination skin. You moisturize the dry part or the sensitive part, and then you use lightweight gels for the oily parts. So when someone asks you what is your skin type, please do well to say I have an oily skin, or I have a dry skin, or I have a combination skin, or I have sensitive skin condition, or I have acne prone skin condition, or a combination skin. Please never say your skin type is dark or fair or whatever. So I guess I have been able to educate you on the various skin types. Once again, this is Femzy Good Life. Please, if you're joining us for the first time, Please do well to subscribe, turn on the notification bell so that you'll be notified each time we post a video. And if you're a returning subscriber, I love you. I love you. Thanks for growing the channel. Thanks for growing the community. We love you. Bye.